We are live. We are live. I'm Dr. Frita. Welcome to Medical Monday, where we talk about all of the hot health topics in the headlines. Yes, this is medicine in the news. Yes, we have a lot to talk about. So let's start off talking about Mariah Carey. She had a double tragedy, unfortunately. Can you believe she lost her mother and she lost her sister on the same day? So we'll talk about that because she actually lost her sister to liver cancer. And so we'll talk about liver cancer, signs, symptoms, and what you need to know. And then we'll talk about T-Boz. Y'all know I love T-Boz from TLC. I actually got to be on a medical panel with her years ago. Now, T-Boz has told y'all off. Yes, she has. She had a health scare. Y'all have been all in her business. Y'all have been making up stuff. But she's gone to set the record straight, and she shared what actually happened with her, and she's given us some great education. And so we'll talk about T-Boz and what her health scare was and how y'all need to stay out of her business and stop making up stuff. But we'll give accurate information right here today on this Medical Monday. And then we'll talk about these mosquito-borne viruses. Raise your hand if you're tired of diseases. Well, guess what? Apparently the mosquitoes and the diseases are not tired of us because there's the EEE virus, Eastern equine encephalitis, as well as the West Nile virus, which Dr. Fauci had. So we'll talk about these mosquito-borne illnesses, signs, symptoms, and most importantly, how to prevent getting them. And guess what else we're talking about? If you want to ride the pink pony. Don't ride it. We're talking about pink cocaine. Can you believe it? Pink cocaine, as if we need another drug. So even if you haven't heard about it, your children have heard about it. Your nieces have heard about it. Your nephews have heard about it. So we'll talk about pink cocaine, what you need to know, the adverse effects, and what's in it, and just why it's really a big problem. Lastly, my favorite part, we've got the live Q&A right here. I'm answering questions live. So go ahead and get your questions together and go ahead and hit like and share this video because we're about to have some good information and some good fun right here on Medical Monday. All right, we're live. I'm Dr. Frita. We're doing Medical Monday. And listen, Super Chicken 1953, I see you. I see you. Okay, I'm here now. And I'm not alone because my co-host, Miss Shador, is coming to the stage. Hello, Shador, my co-host and my practice manager of over a decade. How are you doing?
Doing pretty good. How are you doing today?
Good, good, good. It's Labor Day. Ooh, and I got you out here doing labor because we're about to hit these hot health topics.
Happy Labor Day.
Happy Labor Day. Are you doing any barbecue today?
I don't know. We did a big thing on Saturday with the
community. Okay, that sounds fun. Relax. Good, good, good. I don't know. Ooh, I'm not really sure what I'm doing. My kids are somewhere practicing basketball. They act like that's all they have to do. But I actually had a that's it. What kind of weekend did I have? I had a good weekend. I'm not exactly sure why, but it was actually pretty relaxing. And this morning, Shador, I had a great morning because I was on the national news channel, News Nation, and I was talking about IVF, in vitro fertilization, and why it's become so politicized. And so I'll be posting the link to that video later on, but I was on News Nation. And y'all know that station is a national news channel. It's where Chris Cuomo is. Dan Abrams is on the station. Nicole Burley, Nick Smith, who cracks me up. He's wonderful. So it was a really great interview, an informative interview, which I'm proud of. Got to do that this morning. I'm also proud of the fact that we're about to get into some health topics, Shador. We're about to get into some health topics. So let's go ahead and get started. Make sure you go ahead and like this live, share this live. Go ahead and hit that share button and share, copy link with your group chats, with your YouTube, Facebook groups, whatever you have going on, because I'm giving you some great information and you can get your questions answered by me right here live and on stage. I am Dr. Frita. I'm a medical doctor who has been board certified in nephrology. So I'm a kidney doctor and a high blood pressure doctor. I've also been board certified in internal medicine, pediatrics, obesity medicine. And so I like to talk a lot about a lot. First thing I'm talking about is Mariah Carey. Now, my daughter and I had a debate who was the best singer. And we got it down to Mariah Carey and Whitney Houston. And y'all know I love Beyonce, but I actually went with Whitney Houston. So I want y'all to go ahead and put in the chat, who do you think is the best singer? Mariah Carey, Whitney Houston, Beyonce. All right. But Mariah Carey, with her gift didn't come from just nowhere. It didn't just drop down. her mother was also an opera singer. Okay. Her mother was an opera singer, but unfortunately, her mother passed away. And on the same day, her sister passed away. And apparently, she had complicated relationships with both of them. But let's go ahead and roll the clip and we'll talk about liver cancer, which is what took her sister.
We're learning more about Mariah Carey's double heartbreak, losing her sister and mother on the same day.
She had a very complicated relationship with both her mother, Patricia, who was a opera singer and a vocal coach herself, and she also was estranged from her sister.
Mariah's troubled sister, Allison, died on Saturday shortly after midnight from complications of liver cancer. She was at her home in upstate New York. Their mother died just hours later. In her poignant statement, Mariah says, "I feel blessed that I was able to spend the last week with my mom before she passed." Patricia was an accomplished opera singer. She sang alongside Mariah for an ABC Christmas special in 2010. They received a thunderous standing ovation. But the pair had a complicated relationship, which Mariah wrote about in her 2020 memoir.
Our relationship is a prickly rope of pride, pain, shame, gratitude, jealousy, admiration, and disappointment. A complicated love tethers my heart to my mother's.
Mariah also had a rocky relationship with her sister, Allison.
She'd been sick for about a month.
Allison's friend, David Baker, says she was in hospice care battling organ failure due to liver cancer for 3 weeks. So you were with her every day for the last month of her life?
I was, yeah, right up to the end.
Did Allison in the last weeks make any outreach to Mariah, her sister?
She indicated that she'd like to talk to her. She also said that, she'd like to talk to her mother, but we couldn't make either happen.
Inside Edition interviewed Allison in 1995.
If I ever did have a family, I don't have one anymore.
The deaths of Mariah's sister and mother on the same day is reminding many of the passing of Carrie Fisher and her mom, Debbie Reynolds, who died just one day apart in 2016. Now it's another double tragedy. This time for Mariah Carey.
Yeah, that's really sad. Can you believe it? The same day, her mother and her sister. All right. I want y'all to, did anyone answer in the chat who they think the best singer is? Is it Mariah Carey? Is it Whitney? Is it Beyonce? And who was the first person in the chat, Shador?
Yes, ma'am. First person in the chat was Andrea. Says good afternoon.
Hi, Andrea. Thank you for joining us. All right. What votes do we have? What do they say?
So we have Lofton, Jennifer
Hello.
Hudson.
Oh, now she can sing now. She can sing down. Okay.
Roro, Whitney Houston.
Whitney Houston.
Mad Dollars or Mad Dollars. I'm sorry.
Hey, Mad Dollars, dollar bills, y'all.
A lot of Whitneys.
A lot of Whitneys.
Whitney as well.
Yes. Whitney got me. My youngest daughter said Mariah because of her range. I couldn't mess with her on that range because she really, especially in her early days, had really great range. But yeah, so Mariah Carey's sister passed away with liver cancer. And so liver cancer is when there is a mutation in the DNA of the cells of the liver, okay? And it alternates and makes those cells grow and divide in an abnormal fashion to the point where they take over normal cells and then they become very harmful, toxic to the body, and deadly. The most common cancer that's in the liver is actually cancer that spreads or metastasizes from other organs. So for example, a colon cancer that spreads to the liver or a breast cancer that spreads to a liver. So metastatic cancer in the liver is the most common cause of actually cancer being in the liver. But in those cases, we don't call it liver cancer. We don't call it primary liver cancer. We call it colon cancer that's metastasized to the liver, or we call it, whatever the origin is that's metastasized. As far as cancer that originates in the liver, it's actually liver cells. Okay. You have hepatic cells or hepatocytes. So people who are at risk for liver cancer, if you have chronic inflammation or chronic damage in your liver, then you can be at risk. And first off, let's just talk about what the liver is. It's actually the largest solid organ inside of your body, the largest organ inside of your body. Hey, what is the largest organ period on your body? Put that in the chat. I guess a semi-trick question. The largest organ period of your body. Okay, but the liver is specifically the largest internal organ. Okay, the largest internal organ. It's about the size of a football, and it sits over on the right side of your abdomen, the right upper side. And the liver literally has over 500 functions. It does, but it also is a part of digestion. It helps with digestion. It helps to get rid of toxins in the blood. It helps you with your clotting. Okay, the liver does. And so, of course, when you have cancer of the liver, it can be very detrimental, very fatal. So as far as people who are at risk for liver cancer, so yes, if you have infections like hepatitis B, hepatitis C, if you have chronic inflammation like that NASH, a lot of people have NASH, non-alcoholic steatosis of the liver or fatty liver, that can put you at risk for liver cancer. Also, if you have cirrhosis of the liver, that can put you at risk. Certain other infections can do it as well. Even having diabetes can put you at risk for liver cancer. Certain genetic diseases like hemochromatosis, Wilson's disease can put you at risk. So lots of different things can put you at risk, and being a chronic long-term drinker of alcohol can put you at risk as well for liver cancer. Early on with liver cancer, it's often asymptomatic, meaning you don't have any symptoms, you don't know you have it. But as it progresses, liver cancer, as it progresses, you might get an unintentional weight loss. Okay, you're dropping off this weight, you didn't do it on purpose. You might get an abdominal bloating or an ascites where you get fluid inside of your abdomen. You can get veins that are really prominent on your belly that really stick out. Okay, you can get easy bleeding. You can also get jaundice or the yellowing of the sclera or the white part of your eyes, or a yellowing under your tongue, a yellow that you see on the palm of your hand or on your skin. All these things can happen with liver cancer. And ultimately, it can be fatal. Okay. So if you have any suspicions that you may have it, if you have any of the symptoms I'm describing, you want to see your doctor. They'll do a complete history and physical. They'll also do some blood tests. They'll check your liver functions, and they can do some imaging, right? Like CAT scans, MRIs, ultrasounds to see if you have any masses in your liver. And as far as treatments, there are various treatments. It could be radiation, chemotherapy, but make sure you consult with your physician. If something's going on with your body, check it out. And as far as those risk factors I'm talking about, some of these are common risk factors, especially the alcohol drinking. Make sure that you try to keep those in check and consult with your doctors for help with that. And as far as the alcohol, make sure you check out my video right here on this YouTube channel, The Dark Side of Alcohol. I go into the details of alcohol, how it affects the liver, and what's considered to be an overuse of alcohol by the CDC. Okay. All right. Let's see. Do we have any questions this far, or any
We
comments?
did ask a question: what's the largest organ of the human
Yeah.
body?
What answers do I have? Let me see what the
So the
net heads have to
majority,
say. Uh-huh.
and the first person to chime in would be Planet Life with
Hi.
skin.
That's it. The skin is actually the largest organ. Did anybody else get that right?
Yes, a lot. Miss Lena,
Hi, Miss Lena.
Audrey,
Hi, Miss Audrey.
Nick Nat. Hello.
Hey, Dick Nat, Patty Whack, give the dog a bone. All right, y'all are all right. Y'all are on today.
They're on it. Christine and Lola.
Very good. That's right, because most times when you think about an organ, you don't necessarily think about the skin, but it's so important, right? Number one, it keeps all your other organs, a nice protective covering. It helps you as far as making sure that you have proper fluid balance. Imagine if you didn't have skin and you just had liquid and you'd be evaporating everywhere, you'd be dehydrated. It's your first immune protection, right? It's your first barrier. That's why if you get a cut in your skin, of course, you're more likely to get an infection, which can seep in, eventually cause sepsis or an overwhelming infection. But that skin is acting like a barrier to protect you from infection. So the skin is a big deal, and it's the largest organ. But as far as the internal organ, the liver is the one that we're talking about. So yeah, condolences go out to Mariah Carey, to her loved ones. And if you have any questions, we'll get to those in the live Q&A section. And until then, we will keep on moving. Next, I want to talk about these viruses, Shador.
Mm-hmm.
These mosquito-borne viruses. And I actually had the opportunity to be on News Nation, that national news channel, News Nation, where I had a great conversation with Brooke about specifically the EEE virus, Eastern Equine Encephalitis virus, because we've already had at least one death from that mosquito-borne virus. Today, I'll talk about that, but I'm also going to talk about West Nile virus, and we'll do a little compare and contrast. So please go ahead and roll that clip of my interview.
Yes, ma'am.
need to know and how to protect ourselves. Let's bring in Dr. Frita Fisher, founder and president of her own nephrology practice. Dr. Frita, good morning to you. These warnings sound incredibly serious. Help us understand the magnitude of this.
They are serious, Brooke, because though it is rare, triple E is potentially very fatal. We know that back in 2019, it had a 50% mortality. The typical mortality is about 30%, meaning that 30% of the people who get the encephalitis from the virus will die. And so it's very serious to know how to protect yourself, because we actually, unfortunately, have no specific treatment for the EEE virus. There's no specific human vaccine. And so the prevention is key, and recognizing symptoms is key.
Right. What are some of those signs and symptoms that people should be aware of?
Yeah, so most people will have no symptoms, but about 4 to 10 days after being bitten by a mosquito, people can develop confusion, headache, fevers, diarrhea. And if it progresses to encephalitis, which is inflammation of the brain, or meningitis, which is inflammation of the membrane surrounding the brain and spinal cord, it could lead to paralysis, intellectual disability, and even death.
What precautions can people be taking? I mean, I think hearing these headlines
All right.
is so scary because, you know, you've got.
All right. So let's see. So you can actually go to my Instagram at Dr. Frita, and I have the whole interview there. And remember, I put different content there than I put here on the YouTube channel, so you can see the full interview there. And so we'll go ahead and we'll get into talking about the triple E virus. So my Instagram is at dr.frita. Go ahead and give me a follow there. Yes, I give lots of short form content there. I also talk about some of the personal things going on in my life and different little entertaining factors. And sometimes I'll give different recipes on Instagram. So make sure you go ahead and give me a follow over there. And right here on this live, please make sure that you like this live, you share it, and go ahead and subscribe to our YouTube channel, Dr.Frita, if you have not done so already. So let me ask this. Put a 1 in the chat if you had already heard of triple E virus. Put a 1 in the chat if you had already heard of triple E virus. Because for whatever reason, I find that a lot of people knew what West Nile virus was, but they weren't really familiar with triple E. And so I'll have you put a 1 in the chat for that. And then also, I'm going to ask in the chat if you put ways that you think that you can prevent getting bitten by a mosquito. So put different ways that you can prevent getting bitten by a mosquito. And then I'll talk about triple E virus. I'll talk about West Nile virus. And then I'll see what y'all have to say about prevention in mosquito bites. All right. So we'll start with the triple E virus that I was just talking about, the Eastern equine encephalitis virus. It's actually rare. So that's good to know. Back in 2021, we had about 5 cases, and the most cases that we ever have had reported in the United States has been 38 cases in a year. That was in 2019, and we had 19 deaths that year. So that was our worst case thus far. But we do still get it here every year. We tend to get it in places like New England. Okay, so New Hampshire, Massachusetts, some of the states that border the Great Lakes, and some of the states that border the Atlantic Ocean. Okay, that doesn't mean it's just limited to those states, but those are some of the states where we see it. And we know that we've already had a death from this 41-year-old male who was reportedly healthy. Okay, he wasn't immunocompromised according to his family and his loved ones. He was 41, and he actually just recently died of the triple E virus. And with the triple E virus, it is quite fatal. Okay. The average mortality is about 30%. So about 30% of the people bitten will get the encephalitis and will lose their lives. The bad news about the triple E virus is that we really don't have a vaccine. We have no human vaccine for the triple E virus. We also have no specific treatment for the triple E virus. Okay. There's general treatment like rest, IV fluids, painkillers, maybe even an immunoglobulin, but there's no treatment. No specific treatment. And so your best bet is to try to prevent getting bitten by a mosquito, which we know in the summertime is a little tricky to do, but I'll see what your answers are, what the med heads have to say, and we'll talk about how we can protect ourselves. So that's the triple E virus. And of course, it is a mosquito-borne infection. So you get it by being bitten by an infected mosquito. Okay. You don't get it from kissing, hugging, loving. That's not how it's spread. You don't get it from coughing, sneezing, respiratory droplets. That's not how it's spread. It's spread by being bitten by a mosquito. Okay. And then there is the West Nile virus, okay? That's also a mosquito-borne infection. And Dr. Anthony Fauci recently reported that he was infected with the West Nile virus. Fortunately, even though he was hospitalized initially, he's now recovering at home. But the West Nile virus is another one of those viruses that can lead to encephalitis, which is inflammation of the brain. Meningitis is inflammation of the membranes covering the brain and the spinal cord, and they both can have really bad fatal consequences. So Dr. Fauci believes that he got it from being in his backyard in Washington, D.C., in the garden, got bitten by a mosquito, and he got it. So let's talk about West Nile virus versus the EEE virus, or the Eastern Equine Encephalitis virus. So they're both bad news. You don't want either one of them. But I will say that the EEE virus is more fatal. Okay, with the West Nile virus, there's a less than 1% mortality, less than 1% for that West Nile virus. For the EEE virus, it's a 30% mortality. Okay, so it's more fatal, but both of them can, it can be asymptomatic. You can have no symptoms. In fact, 80% of people who are infected with West Nile virus are believed to have no symptoms or minimal symptoms. And 80% of the people with West Nile virus will do just fine, 4 out of 5. But for the unfortunate ones who do progress and have symptoms, they tend to be fever, flu-like symptoms, body aches, myalgias. You can get diarrhea, nausea, vomiting. And then once you get neurological symptoms like the encephalitis or even meningitis, that's when you can get confusion or altered mental status, seizures, paralysis, intellectual disability, and you can even be unalived. Okay, it can lead to death. Both of them can do that. So the main difference is that the Eastern Equine Encephalitis virus, the EEE, is more fatal. The mortality rate is higher. Also, the EEE virus is more rare. Okay, it's less common than West Nile virus. Like I said, there was one year that we got only 5 cases, but the West Nile virus is actually more common. We get thousands of cases each year. And in 2023, we had 2,400 cases. Okay, we get thousands of cases of West Nile virus each year, but less than 1% mortality. So that's the main difference. And if you have any questions, we can talk about maybe a couple of them here or in the live Q&A section coming up. So now let's talk about prevention. Shador, did any of the med heads chime in on how to prevent getting either one of these mosquito-borne illnesses?
Yeah, so TS has a couple of options.
All right, let's see what we got.
A mosquito net or hat and hood, DEET, long sleeves, and long pants.
Okay, well, you hit them all. You hit them all, TS, and that's absolutely right. So a mosquito net, and then specifically like screens in your house, right? So making sure that you have screens on your doors, screens on the windows, so mosquitoes won't fly in easily. And you want those doors to be sealed off and the windows to be sealed off. All right. Long sleeves, I agree. Wearing long sleeves tucked into long pants, even though it's the summertime and it's hot, because that's when these viruses, these mosquito-borne viruses are most common in the late spring and in the early fall. And so August, September, where we are right now, July, when it's hot, that's when the mosquitoes are out. And then DEET, that's very important. You want to get an insect repellent that has DEET or some of the other EPA approved repellents. So the Environmental Protective Agency, if you Google EPA approved insect repellent or EPA approved mosquito repellent, and yes, many of them will have that DEET and they're effective for you to spray and keep the mosquitoes away. All right, good work, TS.
Yep.
Anyone else?
Yes, a couple of other, well, Johnny, I'm sorry, tongue tied today. Johnny says they hate garlic. Mosquitoes hate garlic.
Oh, that's interesting. I actually hadn't heard that one, Johnny. So, mosquitoes hate garlic. A lot of other people do. If you have garlic and you are around here trying to talk in people's faces, that could be a problem. But I will say that is, as far as I know, the garlic in and of itself is not one of the EPA repellents. And so still I would recommend Googling or going to the EPA website to see the ones that are official. But that's interesting. I'll tell you what, it's great to actually eat garlic. Garlic is one of those foods that can help you to lower your blood pressure naturally. It has something in it called allicin, which causes your blood vessels to relax and dilate, helps you to lower your blood pressure. Garlic does. It's also good for the immune system.
Yeah, and I read recently, coffee grounds. You use coffee grounds placed out and about, garage, kitchen, whatever, to help keep mosquitoes and things away.
Oh, that's interesting.
Who knows?
Okay.
DJ.
Hey, DJ. That's a, oh, okay. What's going on, DJ?
Insect repellent, or wearing light colored clothes not to attract mosquitoes.
Very good. So, yeah, definitely the insect repellent. And as far as the evidence-based medicine, which is what we share here, you want to stick with the EPA approved insect repellent as far as what's official. And there are other things, like I know at my house, I'll use citronella candles, and I'll put the citronella bracelets on, like back when that Zika virus was around. Ooh, child, I was scared of that one, and I actually went to Central America during that time. Why I did it, I don't know, but didn't get it. So yeah, but as far as official evidence-based EPA approved insect repellents. And then yes, I like the idea of wearing light colored clothing for a few reasons. So still the long sleeves tucked into long pants, closed-toed shoes, all of that. But if you wear clothing that's light, white, pastels, then at least if a bug is on you, you'll be able to see it more easily with the mosquitoes and also the ticks. We talked about that before on this live. Ooh, because y'all remember Serena Williams' husband got Lyme disease, one of those tick-borne infections. Oh, you don't want it. All right, good work.
Zaymon has an easy solution, Dr. Frita.
I don't even want to know. Who got an easy solution?
Zaymon. He says, stay inside at night.
Okay, let me tell you. Officially and evidence-based, that is a very good thing to do. Stay inside at night. So everybody's like, we outside, don't go outside. But you know, realistically, that's kind of tough to do. Hold on just a second, Shador.
Okay.
All right. I feel like, can y'all still see me? I lost myself.
Yes, we can see you very clearly.
Oh, you see me. Excellent. Okay. Well, I can't see me. All right. So yes, stay outside, stay inside. You know, it's Labor Day. I know all y'all got barbecues and cookouts and all these things y'all are going to. Here in Atlanta, we had Dragon Con this weekend, Pride weekend. It's Labor Day. Kids are out of school. Folks are out of work. Everybody wants to go outside. But specifically, that time of day that you mentioned is correct on when you want to stay outside, because mosquitoes are outside mostly from dusk to dawn, right? So avoid being out there right around sunset, avoid being out there right around sunrise, which is difficult to do, you know, because that's when kids get out of school. That's when they want to play. They want to roller skate. They want to slide to the left and to the right. And that's when adults want to be out, right? That's when you go out and you walk your dog, or you might sit on your porch and just cool out, you know, after a long day's work. But that's when mosquitoes are outside. So if you avoid being out there from dusk to dawn, go inside. Then that's going to actually help you. So that's actually a very good one. Thank you.
That is a good one. Thank you. And you mentioned citronella. Janetta says eucalyptus.
Oh, and see, both of those things smell really good. So, and again, I'm not sure if that's one of those ones that's EPA approved, just like my citronella. I don't know if that's EPA approved, but I bet I use it. And I really, really believe that it actually helps. But yeah, so very good. All right. Thank you. Thank you. Do you have anyone else?
No, that's about it. Everybody pretty much saying the same thing. Citronella, eucalyptus oil, insect repellent.
All right. So we hit on the major ones, the insect repellent, like you said, the with the EPA approved insect repellents. We talked about the screens. We talked about the doors. Here's something else that's important as far as preventing getting bitten by a mosquito. Avoid standing water. Okay, get standing water from around your house. So tires, like old tires that are spare tires that tend to have water, they collect water in the rain, get rid of them. Mosquitoes love to go there. If you have flower pots and standing water gets in there, dump that water, get rid of it. Mosquitoes like to go there as well. What else? Like bird baths. That's another source of standing water. So get rid of standing water. You know, you don't want to be around it. That's where the mosquitoes go. And also, you know, our governments will help the government. The government will help to protect us, because in high risk areas, they'll do the aerial spraying of insect repellent. You know, that would help to kill some of the larvae, like some of the little baby mosquitoes, before they even get to move around and give us infections. Or they'll do some local spraying where mosquitoes are to help get rid of the mosquitoes. By the time it gets really cold, like a really good frost in the fall, that's when our risk will go down. But right now it's hot. The mosquitoes are outside. And so if you don't want triple E, and if you don't want West Nile virus, then the best idea is not really to go outside like that. Okay, so if you have any other questions, then we can hit them in the live Q&A section, and you know, unless some pop up right now. But other than that, we will move on to the next topic at hand. All right, I want to talk about pink cocaine. I do, and I promise y'all that's not why I have on pink today. But I want to talk about pink cocaine because I just don't think we need another drug. Put a 2 in the chat if you had heard of pink cocaine, if you've heard of pink cocaine. Okay, a 2 in the chat if you've heard of pink cocaine. Well, it's here. So we got to know about it because it's a bad idea. It's an illegal drug and it's a polypharmacy, a bunch of drugs at the same time. Our kids are taking them, not our kids necessarily, but children are taking them. Adults are taking are getting into pink cocaine. It's considered to be like a party drug. So let's roll this clip and let's talk about pink cocaine and what we need to know about it.
Pink cocaine on a messaging app through her cell phone. Here's what authorities say was her menu of drugs for sale. She's accused of then shipping the drugs through the mail straight to customers.
You have this criminal underworld that has weaponized social media to push their poison to the far reaches of the United States.
Replay. My apologies, guys.
Oh, no, that's okay.
Back now with the troubling rise of a new drug making its way across pink cocaine.
The mystery drug hitting the club scene with urgent warnings from the DEA and prosecutors tracking closely. Eyewitness News investigative reporter Dan Kraut has this story.
It's just as colorful as New York City's nightclub scene, but the narcotic cocktail could be dangerous, even deadly.
Well, I mean, it looks like cotton candy. You know, it may have that kind of appeal to somebody.
But there's nothing fluffy or sweet about it.
You have no idea what you're taking. The drug supply has never been more dangerous in this city.
It's called pink cocaine.
It's actually not cocaine.
In the cases that the New York City Special Narcotics Prosecutor and DEA have seen, when it's lab tested, it actually has very little to no cocaine at all. Instead, a mixture of cheaper man-made drugs, from ketamine to ecstasy.
So the only ingredient that won't get you high is actually the food coloring.
That's right.
A mixture of dangerous uppers and downers.
When you see that mixture of your body being pulled in two directions, being amped up with a methamphetamine or a cocaine, and being sedated with something like ketamine, you know, that's a recipe for a terrible, terrible effect on the body.
The DEA says in some cases, the deadliest of drugs, fentanyl, is also getting mixed in.
This is 2 milligrams of what would be considered a lethal dose of fentanyl,
where even a tiny amount can be deadly.
They're mixing fentanyl in because they want to increase addiction. They want to increase their customer base. They want more people to come back and buy their drug. And it's something that every parent should be concerned about.
These drugs aren't being sold as you might think on street corners. Prosecutors say they busted a New York City woman this summer for selling pink cocaine on a messaging app through her cell phone.
That's a mess. Pink cocaine. Do we have any twos? Has anyone heard of pink cocaine before, Shador?
Yes, we do have some twos.
Who heard of it? Now, who has their ears to the streets? That's what I want to know. Who heard of
so
it?
Knick-Knack.
Hey,
She's
Knick-Knack.
Two. Only heard of it in relation to Diddy.
Me too. Oh my gosh.
Mm-hmm.
And of course, I've heard of all of the ingredients that are in it, but I did not know that they were doing a mix mash remix of that mess. Yeah, that Diddy. Because you know, in the stories, I'll say allegedly, they said that people who worked for him would have the name brand or the Prada fanny packs, and they would have an array of drugs, including pink cocaine, allegedly. But this is what the people who have accused him, different ones, have said that he had pink cocaine at his parties and just around at all times. Okay, but me too. Oh, Diddy. Mm-hmm. Who else heard of it?
Mm-hmm. Lindsaya, place
Hi, Lindsaya. Okay.
Miss Pat D.
Hey, Miss Pat D. Miss Pat D. Now listen, first of all, I'm glad that you found us at this noon hour, but you keep your ear to the grind. I believe you just sit up and read information all day. I'm not surprised she knows. Miss Pat D be knowing.
Monica, she said Jaguar Wright mentioned it.
Ooh, now Jaguar Wright be having the business, doesn't she?
Mm-hmm.
Okay, but yes, you heard of it, Monica. All right, so pink cocaine. First of all, spoiler alert, is bad news because it is a drug that has many drugs in it. One of the drugs is 2CB, which is a synthetic psychedelic drug, which used to be used to help men with sexual dysfunction. Okay, but it was taken out of the market due to certain side effects. So if it's off the market, why does it need to be in a drug? It doesn't need to be. But that's one of the drugs that can be in pink cocaine. And as they said in the clip, oftentimes pink cocaine doesn't even have cocaine in it. It can, but oftentimes it doesn't have cocaine in it. It's a powdery substance, and it can be in pill form. So people are ingesting it. Okay, they're popping the pill in their mouths, or it can be inhaled the way that cocaine is inhaled. Okay, that's typically how it's taken. So yeah, so 2CB is one of those. It's the psychedelic drug. Something else that's often in it is MDMA. Okay, methylene dioxide methamphetamine, MDMA, better known as Molly or ecstasy. Y'all know Future song Percocet, Molly Percocet. So Molly is in it, MDMA. And I won't go into detail about MDMA, but right here on this Dr. Frita YouTube channel, I have a video, What is Molly? And that's where I tell you all about MDMA, symptoms of it, side effects, what happens if you overdose, all of those things. But I will say that MDMA is another one of those psychedelic drugs with stimulant effects, and it can have all kinds of issues, and it can cause kidney disease. And you remember, I'm a board certified kidney doctor. So that's something that really sparks my attention. People can get kidney failure. They can get hyperthermia, meaning they get too hot. They can get low salt in the blood, or hyponatremia, have hallucinations, all kinds of things from the MDMA component. And again, that's the scary part, Shador, because we're not just talking about that. We're talking about a bunch of other drugs in pink cocaine, because there's more. Okay, that's a 2CB, that's an MDMA. It can also have ketamine. Yeah, it can have ketamine in it. Write in the chat if you know which celebrity somewhat recently passed away with a ketamine overdose. He was found in his tub. A celebrity who passed away with a ketamine overdose. Put that in the chat. And so, yeah, so ketamine is a drug that really is used for anesthesia, right? It's used for anesthesia in putting people to sleep and maintaining anesthesia during surgery. It can also be used by veterinarians as well. But now ketamine is being used to treat depression in some cases, anxiety in some cases. And so now it is also being used medically outside of just anesthesia. But it can have all kinds of issues, of course. Now, as far as people taking it as a drug, it can cause you to be in this dissociative state. It can give you amnesia and kind of help you to float away, as they say. So ketamine is another of the drugs that's in the pink cocaine. Y'all notice I haven't said cocaine yet, right? So that's the 2CB, that's the MDMA, that's the ketamine. Something else that can be in it, because there's different mixtures, because clearly this drug is not FDA approved, so who knows what you're getting, but caffeine can be in it. Why do I mention caffeine? Yeah, people can put caffeine in it, and caffeine is a drug. Did y'all know that? Caffeine is the most commonly used drug worldwide. It's a drug. It's just not illegal. Lord knows it's not illegal, but caffeine, we know, can have a stimulant effect. And I won't get into detail, but that's another one I have right here on this YouTube channel, the Dr. Frita YouTube channel. Once you finish watching this live, check out my video on caffeine. Is caffeine bad for you? Because I know y'all be out there drinking caffeine. Put a 3 in the chat if you have to have your little cup of coffee or your caffeine every day. Okay. Has anyone put which celebrity recently died of ketamine overdose, Shador?
Yes. TS.
Hi, TS.
M. Perry or Matthew Perry.
Matthew Perry. TS, you know what? You're gonna move to the head of the class right away. That's that. TS be knowing Matthew Perry. And that was really tough because he was so open and honest about his struggle with substance abuse. And I remember, he had written a book, he was on The View, and it just goes to show, money can't buy you happiness. I mean, I wouldn't mind having more money to try to see, but he had, on the surface, it appears like he had it all, right? But he had that addiction, that substance abuse that really got him. And his ketamine, as far as I know, it's something that was prescribed to him. So I'm not trying to demonize him in his passing away, but it's just a reminder that even medications that are prescribed, they have to be taken as prescribed, and you can't mix them with polypharmacy, because alcohol, for example, which is not an illegal drug, if you mix alcohol with certain ones of these medications or drugs, that is still polypharmacy, lots of drugs pulling on you and working at the same time. So yes, TS, it was Matthew Perry, so who passed away with the ketamine. All right. So that's pretty much the main mix of the pink cocaine. I hit it 2CB, the Molly or the MDMA, the ketamine, the caffeine, and sometimes people will put caffeine in it. Oh, Shador, sometimes folks will put fentanyl in it. They
Oh,
tried it. Yeah, they tried it. They'll put fentanyl in there. So you'll get a narcotic in there as well. And we know that fentanyl is a very potent synthetic narcotic, right? We know that it's stronger than heroin. And y'all know, y'all seen all the movies, Lady Sing the Blues. Did y'all see the Audrey Day, Billie Holiday movie? She was amazing in that movie. But anyway, if you haven't seen it, y'all need to see it. It's a Billie Holiday movie with Audrey Day. But, they talk about her and her heroin addiction. So we know heroin is strong. Well, fentanyl is about 50 times more potent than heroin. And morphine, if you've ever been in the hospital and they give you morphine, it can really make you all kinds of loopy. Okay. It can be very strong. Well, guess what? The fentanyl is stronger than morphine. It's up to 100 times stronger than morphine. So the fentanyl is no joke. And all it takes is about 2 milligrams of fentanyl to overdose, right? To have a toxic dose. So if you think about the amount of fentanyl, that a little bit of powder that might go on the tip of a pencil tip, okay, that could be enough to kill you as far as fentanyl. Now, take that and imagine people throwing that in the mix of pink cocaine. People can die. So the point is, if you just keep your ears, to the door of your kids' house. Give your kids privacy, but monitor them appropriately. Because if you hear them talking about pink cocaine, or better yet, go bring it up to them. And it sounds like I said, cotton candy. It sounds fluffy. It sounds harmless, but it's not. It's got all of those substances in it, and it can be fatal. One more important point about this pink cocaine, Shador. If you are around someone who's partying or someone you knows who does substance, and we're not just talking about people who are just strung out and they look like the stereotypical person in the movies. They don't look like Felicia necessarily, or they don't look like, the Chris Rock's character Pookie in New Jack City. There's no look to someone necessarily who's doing pink cocaine. But if you're around someone, you think they are doing a little bit of a party drug, and if they have signs, for example, of a narcotic overdose, and by those signs, I mean pinpoint pupils, like if the black center part of your eyes, if theirs gets really small, if they have respiratory issues like a gargled breathing or really slowed respirations, if they're passed out, if you're suspicious that someone has an overdose, then you want to get Narcan, okay, naloxone. That's the narcotic antidote, Narcan. And pharmacies now, you just call your pharmacist, call your local health department to see if you're able to get Narcan now without a prescription, because it's like a nasal spray, and you can spray it up somebody's nose if they're passed out, pinpoint pupils, if you suspect they've had a narcotic overdose, and it can save a life. And don't worry about saying, I'm not sure, maybe they didn't do drugs. You're not going to hurt them with the Narcan. But if they've got a narcotic overdose and you don't give the Narcan, then that could be fatal for them. And if they don't have any kind of response in like 2 to 3 minutes, you can spray it up their nose again. Okay. And of course, calling 911 all the while. So that is that on pink cocaine. Talk to your kids, talk to your friends. Y'all just don't do it. This is drugs. This is your brain on drugs. Just don't do it. All right, Shador, shall we move on to our next topic? Make sure that you are liking this live. I'm giving y'all evidence-based medicine here on Labor Day. So like it, share it with the people you care about. And also, if, as we talk, if you have any questions, I definitely want you to put them in the live Q&A, but we only have a short time, as you all know, who come and watch me every week. We have a short time for our live Q&As. But now I'm excited because I'm offering something new. I'm offering an exclusive YouTube membership. That's right, the Dr. Frita exclusive YouTube membership. And you'll have access to all kinds of things. One of the important things you'll have access to is a monthly members only live Q&A, where I spend the entire session just answering your personal medical questions for members only. I'll also give you some access to some exclusive content, like some exclusive YouTube shorts, some exclusive YouTube videos, and even for the videos that I'll share, you'll get access to them first. And we'll have fun stuff. We'll have, custom badges, custom emojis, things of that nature. But just join the membership. We're offering it for $10 a month. And y'all know that I like to talk about a lot. I like to give evidence-based medicine about a lot. It'll give you just greater access for members only to have exclusive membership, live Q&As, among other things. So click the link in the description and come on and join us. I'm pretty excited. We're just now starting to offer this. All right. Shall we move to the next topic, Shador?
Yes,
let's talk about T-Boz. And I'm telling y'all right now, I love T-Boz. I grew up on T-Boz, TLC. I used to be doing That's Why I Creep. And they were so cool when they first came out, right? TLC, they were, cute, cool girls, and they wore the big baggy clothes and all of that kind of stuff. And I remember they had that album where all of a sudden they started wearing more fitted clothing instead of just wearing the baggy clothing. They're like, hello, we're still ladies down here, even though we're cool. Well, T-Boz was the one. She did a lot of the solos. And Shador, remember, I got a chance to actually be on a panel discussion with her talking about health. She's a great health advocate. We know that she lives with sickle cell disease, and she shares some other things that she has. And I have to tell you, I'm very impressed in speaking with her, and I was very impressed with her on that panel. It was a panel I was on with through Rollout magazine, and I was on there with Beyonce's father, Matthew Knowles, where he was talking about his health issues and how he's a survivor of breast cancer. Matthew Knowles is, and then T-Boz was on there. I'm going to see if we could put the link in the description here of that interview that I did. That was a little while ago. But now T-Boz is back in the headlines because she had a recent health scare and was hospitalized. But y'all know how y'all do out here on this internet. T-Boz had to come and tell y'all off because y'all were spreading all kinds of rumors and saying, maybe she's doing Ozempic. Oh, it's probably her sickle cell disease. And y'all just got on T-Boz's nerves. So she had to come on out to the front and explain what's actually going on with her, even though, as she says, she's quite a private person. But she shared what she was going through. And I got a chance to catch her interview on the Breakfast Club where she went into detail. And I'll tell you, she's pretty accurate. And she took people being in her business, which she lets us know that it annoyed her, but she also shares really great evidence-based information, and she breaks it down in a really great way. So let's roll that clip and let's talk about what T-Boz has had going on recently.
It can happen to anyone. What happened was I was feeling totally fine. I had got to Syracuse, New York off the plane. I ate something, so that's why I thought I had food poisoning. My stomach felt like if the Incredible Hulk took it and just said Hulk smash, like it was an unbearable thing. It was like I couldn't stand up, I couldn't talk, I couldn't walk. And when the doctor came to see me to prove that I was sick, he immediately was like, she has to go in and admit her. I got there and they were talking about going on the surgery side. I'm like, hold up, wait a minute, what? So what happened is I had a C-section 24 years ago. So this can happen to any man who has had abdominal surgery, any woman who has had a C-section or fibroid cyst removal, anything done to your abdominal that causes adhesions, which is scar tissue. So your small intestines move around, and it had nothing to do with constipation. No, I'm not on Ozempic. No, it had nothing to do with sickle cell. It was just merely scar tissue hit my lower intestine and kinked it and blocked it off.
Wow.
And it moved and healed itself and unkinked. That's how easy it was. But this is something people die from. It's very serious. Some people have to have some of their colon or intestines removed or scar tissue. And many have died from this. It's not diverticulitis. I've seen a lot of people trying to diagnose me. You know what I'm saying? Everybody was a doctor all of a sudden. But yeah, so I said, so since my business is out there, let me turn this into an educational thing and let people know this is really a thing, because I had no idea. The doctor said he's had 80-year-olds who had 50-year-old surgeries, and this can happen. It can happen to anyone at any time. And then most cases, it heals itself like mine did. And I'm 3 days out. I'm already working again. I leave Friday for my next show.
That was great. Y'all, I'm sorry. I love me some T-Boz. And what she said was straight up accurate. And I like the way that she explained it. So her health scare was adhesions. Okay. It was adhesions. And adhesions, it's scar tissue. Okay. It's scar tissue that forms in the abdomen. And as she said, if that scar tissue forms and it causes your small intestine or any of your intestines to get kinked up, if they, get kind of turned around or twisted up in adhesions, then you can actually get an obstruction, like a small bowel obstruction, which can really be a surgical emergency. And so I'll talk a little more about what adhesions are. But as T-Boz said, if you've had any kind of abdominal surgery or abdominal procedure, then you could be at risk for adhesions. It doesn't matter how long, because she said her C-section was 24 years ago. I want y'all to put in the chat, name some different abdominal surgeries or abdominal procedures that you've either had or have heard of that you think could put you at risk for adhesions. Because I'll tell you, anything can do it. But I just really want it on the top of people's minds as we have these lists of surgical procedures. So you can be like, oh, I had that, or my loved one had that. So if ever you get severe abdominal pain, then keep that in your mind on whether or not you need to go to the doctor. Okay, yeah, so put in the chat different surgical procedures, like abdominal procedures that might put you at risk for having adhesions. So yes, so adhesions is scar tissue, bands of scar tissue in the abdomen. And so yes, you're at risk if you've had any type of an abdominal surgery or procedure, but you can also be at risk even if you have not had an abdominal surgery, but you have inflammation for whatever reason in your abdomen. So for example, if you've had appendicitis, you could be at risk for getting adhesions in the future. If you have Crohn's disease, you could be at risk for getting adhesions in the future. If you've had chemotherapy or radiation treatment, cancer treatment that's affected your abdomen directly, you could be at risk. If you've had diverticulitis, okay? If so, we know that diverticula are outpouchings of your intestine, right? So if you think about the intestine as being a bunch of muscular rings stacked on each other. Okay, a bunch of muscular rings, that's your intestine. Well, in between those rings, there's a little vulnerable space that if you strain, okay, especially if you're a person who's constipated, okay, if you strain, then it can cause an outpocketing, like a little pocket in between those rings, and that's a diverticulum. Okay, if you have a lot of them, you have diverticula, and if they get inflamed, you can get diverticulitis. And Lord help us if you actually get a hole in one, you can have a perforated diverticulitis, and that can certainly lead to inflammation, which can lead to adhesions, even if you never had abdominal surgery. Also, if you've had PID, pelvic inflammatory disease, that could put you at risk for adhesions. Or if you have endometriosis, okay, that's an inflammation in the abdomen that could put you at risk for endometriosis, for adhesions as well. So yeah, so if you get those adhesions, and so you got the scar tissue, and your intestines are moving along with their peristalsis, but they mess around and they get to a spot where there's scar tissue and what's in your intestines can't move on, then you can get severe abdominal pain. You heard T-Boz said it felt like Hulk smash. I thought it was kind of funny how she described it, but a severe abdominal pain. You can also get nausea, vomiting. You can get to a point where not only are you not passing bowel movements, you might not even be able to pass gas if you have an obstruction of the bowel, okay? And it can be fatal. It is a surgical emergency. In T-Boz's case, it looks like her intestines kind of kept moving and it was able to self-correct. In fact, most people with adhesions don't have any symptoms and will never have symptoms. Many people can self-correct. But in the case where that obstruction is not getting any better, it can lead to sepsis, okay? Septic shock, overwhelming infection in the body, and you can lose your life, okay? So adhesions are very serious. There's no joke. Adhesions can also cause some organs to stick together. Okay, so you can get an adhesion that causes your intestines to stick to your bladder. And you can even get a connection or a fistula in between them, and you can be urinating out fecal matter. That's happened to several patients. This patient we see now, Shador, that happens too. So adhesions can do all kinds of things that aren't fun. So, but the important thing is to contact your doctor, activate EMS, call 911 if you suspect that you're having adhesions. And did anyone put in the chat different surgical procedures that could put you at risk for adhesions? Who do we have, Shador?
Yes, quite a few. So we'll start with Planet Life.
Hi, Planet Life.
Gallbladder surgery.
Yep, that could do it. And even if it's not a complicated surgery, just from a surgeon being in there moving around can lead to an inflammation. What else?
Yeah, TS named a few.
Okay.
C-section.
Yes.
Hysterectomy. Bladder prolapse repair.
Absolutely. All those things can do it. So if you're listening and y'all have had these surgeries, if you ever get a severe pain, nausea, vomiting, can't pass gas, can't pass stool, just keep it on top of mind. Okay. It's an emergency. Adhesions causing small bowel obstruction.
DJ mentioned abdominal or stab wound.
Oh, that's good. Absolutely. So abdominal wound, like you could have a gunshot wound to the abdomen, certainly a stab as it heals, that can cause a scar tissue. Okay.
And Zaymond, hernia mesh.
Hernia mesh. Oh yeah. So if you had hernia repair, and so then yes, they are manipulating your intestines, even if they're not doing a lot of cutting. But yeah, a hernia repair surgery, and then they'll put a mesh there. You can get scar tissue that's there that can lead to bands of scar tissue, which by definition is an adhesion. That's a good one. Yeah.
Marilyn had a question regarding a particular surgery. She says, hi, Dr. Frita in chat.
Hi.
Tubes tied over 40 years ago. Do having this surgery, can it make scar tissue?
Which surgery? I'm sorry.
Tubal ligation.
Oh, absolutely. Absolutely, having a tubal ligation, any surgery in the abdomen. So it's something to think about if you're getting severe pain, nausea, vomiting, abdominal distension, inability to pass gas, especially in you're vomiting up, especially if it's like a bile colored, like a pool table green, it could be an obstruction. So yes, definitely tubal ligation could put you at risk. Yeah.
What about Fahim says feeding tube?
Now the feeding tube is different. I'm glad you. There's different types of feeding tubes. Okay, so let's talk about that. That's a good one. Okay, so if it's a feeding tube that you have just temporarily, as in one that's going in your nose, down your throat, on into your stomach, then no, that's not going to put you at risk for adhesions. But if you have a PEG, so if you have a feeding tube that's actually in your abdomen and that's put directly into your stomach through your abdomen, then there's some manipulation that could lead to scar tissue. Now that procedure tends to be kind of an outpatient, quick surgery without a whole lot of manipulation, but technically any type of a surgery or manipulation of the abdomen could put you at risk, but not the one that's in the nose, not that temporary feeding tube. Good question.
And then this is ISH heart emoji in. I'm gonna call it ish. Tummy tuck and liposuction? Question marks.
Okay, so the liposuction, less likely to do it. You know, that's kind of more superficial. The tummy tuck, yes, we're dealing with an abdominal surgery because again, even if there's no major cutting inside of the intestines, just the manipulation could potentially. What's that?
Ishan, ISHAN.
Ishan. Okay. But yes, so it could potentially put you at risk if there's any kind of manipulation of the intestines.
All of us. Hepectomy.
I'm sorry, what?
Hepectomy.
Let's see. So if like a piece of the liver being removed, let me see how are you spelling that here?
HEPATECTOMY.
So yes. So if there's some type of a cutting or removal of part of the liver, because usually when you see HEP, they're talking about the liver, then that can certainly put you at risk for adhesion. Some scar tissue could develop. Right. All right. Y'all make sure that you like this video, share this video, subscribe to this YouTube channel. And even if folks aren't here, if they didn't catch us because they're already outside, please go ahead and share it and tell a friend to tell a friend because we're giving evidence-based medicine here. And we will be wrapping up soon. Do we have time for a couple questions in Q&A?
Yes,
okay.
Yes, I have 2 questions I want to address.
Okay. So as we get ready to get into those questions, remember that if you join the membership, then I will spend a whole time for members only. We'll go into detail for Q&A. But if you have personal questions and you really need just some one-on-one time and you really need me to dissect your entire history and give you my medical advice, I do offer a telehealth concierge service. You set up an appointment, you can click the link in the description, and that would be one-on-one where I take a detailed history and I can really give you information that's more personal to just you. So make sure that you check that out if that sounds like something that you're interested in. We've been having great success. I've had very happy customers, very happy patients after doing this telehealth concierge service. Also make sure you check out, I have a download. I always love to give you a good freebie. You can download a free PDF, 10 Healthy Habits for a Better You and a Better Life. So with that, we'll go ahead and hit these last couple of questions and we'll go ahead and close out so y'all can go outside with your EPA approved insect repellent.
All right. So this comes from Planet Life. Hello.
Hello, Planet Life.
Hi, Dr. Frita. I have been dealing with Tourette syndrome and I have been having a hard time controlling my motor and vocal tics. What can I do to reduce my tics? Thank you so much.
Okay, Planet Life. So Tourette syndrome is something that is actually more common, I think, than a lot of people realize. So with Tourette syndrome, it's when you have involuntary tics. Okay, so it can either be verbal tics, right, where you blurt out things and you can't really control it. It's like an impulse and you just say things. We see a lot of times that it's stereotyped, or you'll see it in movies where they have the coprolalia or the potty mouth, right, where people are blurting out curse words, but that's a real thing. It can happen. People blurting out phrases and they just can't help it. You can also get the verbal tics in the sense of just making a sound, like you might just make a tisking sound or blowing sound, and it's something that you're unable to control. People can also have motor tics, okay, like a blinking, okay, or a head twitch, or a shoulder twitch, any of these type of involuntary movements or involuntary sounds are a part of Tourette's syndrome. Now, we often see it in children, right? And it can have different associations, like associations with OCD or obsessive compulsive disorder, or even obsessive compulsive trait. And so what I would recommend, because again, here on the live, I give information, not medical advice, but in general, if you've been diagnosed with Tourette's syndrome, or if you're someone who's listening and you're suspicious that you might have Tourette's syndrome, you definitely want to consult with your physician, and they will likely have you to see a Tourette specialist, which oftentimes is a neurologist, okay? Someone who specializes in nerve disorders. And sometimes psychiatrists are able to treat Tourette's as well. But I would definitely consult with your doctor and I would ask about seeing a neurologist. There are certain medications, okay? Some interesting choices, even clonidine, which is a blood pressure medicine. There are some medications, but if the Tourette's is not something that is causing major social issues, okay, if it's something that you're kind of able to play off or just live with, and sometimes they won't recommend the medications. And if you're someone who's dealing with a child who has it, oftentimes children will outgrow it. You do have to beware, because many kids who have Tourette's may also have other things like ADHD, and sometimes a medication that treats ADHD can worsen the Tourette's. So my best advice to you is to consult with your doctor and actually see a Tourette specialist, like a neurologist. Okay, thank you for sharing, and I wish you the best of luck, Planet Life.
Thank you, Planet Life. Zaman, we're going back to the abdominal surgeries or procedures. He says, what about colonoscopies?
Interesting. So it's not likely. The colonoscopies are not likely. I did say that if you have a whole lot of manipulation and movement, even if there's not a whole lot of cutting, then it's possible to get adhesions. But with the colonoscopies, those are typically very controlled, where there's not a whole lot of movement. It's a very thin camera with the wire that's going up, looking through the bottom and on up to the intestines. Not a whole lot of manipulation, so not likely. Now, if you have a complication in your colonoscopy and you get a perforation or a hole in your colon, that's a whole different story. But in general, just having a colonoscopy is not going to put you at a high risk for adhesions. Not going to put you at a high risk.
All right, thank you. Hurley asks Dr. Frita, what's the best things to flush out your kidneys?
Ooh, okay. So flushing out the kidneys, and this is one thing that I go over because, as you know, I'm a board certified kidney doctor. The kidneys are a filter, okay? They are a filter, but they're not a filter in the sense that like your air conditioning has a filter, or your car might have a filter. It's not like you can just grab something, clean them out, and then you're done. It's much more complicated than that. It's tiny little blood vessels in the filtering system. So there's not a one-stop shop in cleaning out the kidneys, but there are things that you can do to help your kidneys to filter better. Certain foods, certain things you can do as far as lifestyle. One, you want to make sure you maintain a good blood sugar, because diabetes is the #1 cause of kidney failure and the kidneys not filtering properly. You also want to make sure you maintain a good blood pressure, because high blood pressure is the second leading cause of the kidneys not filtering properly. You want to drink plenty of water. And I have a video right here on this YouTube channel, the benefits of drinking water for the kidneys. And then there are certain foods that tend to be kidney friendly that can help with increasing vascular flow. So like garlic, celery, beets even. Beets have nitrates, which your body converts to nitric oxide, which helps the blood vessels to dilate. That increases the flow. Even carrots. Check out on this YouTube channel, dr.frita, where I'm proud to say we have over 750,000 subscribers. If you go to my playlist, I have a kidney playlist where I talk about the truth about kidney detox. That'll be a best place to start. The truth about kidney detox, where I go into details about foods that help your kidneys to filter better. But that's a great question. You'll find a lot of information right here on this channel.
Good question. One more time for the people, Dr. Frita. Goldie wants to know, how do you become members only?
Yay! Well, click the link in the description. Click the link in the description. We are charging $10 a month, and you will get a lot for that, because you'll have access to members only questions, where we have an even closer interaction, where for the whole time I'll just be answering your questions. And again, you also get some exclusive content, some exclusive videos that I'll share. And even for videos that I plan to share with the public, you'll get the first access to a lot of information that I give, and your customized badges and emojis and other little fun stuff like that. But just click the link in the description. You'll be able to join the membership.
And special shout outs. We have a first member, Dr. Frita.
Oh, Yay! Who's our first member? Oh, you go down in history as being our first member because we just released this. Yay!
People.
Well, hold on. Oh, thank you so much for joining. I appreciate you. Oh, how cool. All right. Well, I can't wait to see you and to talk to you in our exclusive members only live chats that we're going to have. I appreciate that support. How cool. We're going to have fun with this. So yeah, so make sure y'all come on and join her. Don't leave her out there by herself. Don't leave her out there like that. Come on, join the membership. Yeah, you know we're going to have a good time, a good medical time. And y'all know I'm going to give you some evidence-based information. And you know, we like to have a little fun as well. So that's pretty cool. Thank you. All right. Well, I certainly thank y'all for joining us on your holiday. We're going to be here. We are here every Monday, noon Eastern Standard Time. Make sure that you subscribe and hit the notification bell so you'll be among the first to know when I release new content. Also, so you'll know if there are any changes to the time. I appreciate your support. Appreciate you for watching. Thank you, Shador, as always. Give it up for my wonderful co-host and my practice manager. All right. I'm Dr. Frita, and we will see you next week for another Medical Monday where we talk about all of the hot health topics in the headlines. Y'all have a great day.